You guys, did you guys find the desserts? There you go. All right. So make sure you didn't miss out on the desserts. So good. All right. You got the desserts too? Good. All right. Tiramisu.
Rich, really fascinating. Yes, she does. What's up, train around the house? We actually have to go there.
Although they be 6 day 3 part Sunday. So I made the decision. And all got Computer's out. Computer's out. Glad to be here.
Sir. Otherwise, we have hats, we can just have.
Seems like a thing to do. I will have. Yeah. That's what I say. She's the keeper.
Rarely nice.
All right, good afternoon, everybody. Welcome to the Rotary Club of Greater Huntsville. We've got a great crew here today. It's nice to see all the fun, friendly faces and cool hats in the room. We have special international guests here today we're very excited about, and we have all of our good friends on Zoom. You'll figure out what the house hat is for later if you haven't already. But do want to say a special welcome to our friends from Kyrgyzstan. So thank you for being here, and Jackie Scheib's crew from Global Ties. We'll bring them up and introduce them a little bit later. In the meantime, we're going to start with a great song from Mr. Bill Redford.
Thank you, Chris. We're gonna do a Ray Stevens song today, and we're not gonna do It's Me Again, Margaret. We'll have to do that for another day.
I like that one.
But this is a great classic from the 50s. Can't be. It's sad, can't be. I'm walking on clouds, I can't stand for the distance. Walk wild. On my own. Right from my left, my hand from my glove to this sea, to and say that you're leading me on, but it's just what I want you to do. Don't you know just how honestly I love you? That's what I'm talking all right on. I'm under this wonderland alone. My right from my left, my hand from my glove, my fist to
Thank you, Bill. And lead us in the pledge, we have Gary Donald, please.
Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, indivisible, with liberty and justice for all.
Mike's gonna lead us in invocation. Mike, thank you, sir.
Please pray with me. Heavenly Father, as we enjoy our fellowship, help us remember how fortunate we are to be able to serve others, both locally and overseas. Help us as Rotarians to do good, to be honest and ethical, and to continue to serve others. But most of all, help us reflect on what a wonderful week this is. That your Son, our Savior, died for us in order that we can live. Bless all those sworn to protect us and for those who have prepared this meal. In your name we pray. Amen.
Amen.
Thank you, Mike. Okay, go ahead and finish eating for a couple minutes and we'll get started.
Yes. Yes.
We have post game. Okay, yeah. On Saturday. Plan.
Turkmenistan or Kyrgyzstan? Sorry? Oh, okay. What's the capital of city? I believe it is. Glad to have you all tonight. Jackie. Trying to change the way. He's sponsored next Thursday. Yeah. Yes, thank you.
It's been really nice to plan this contact.
I just hire your hat.
Because
This
I
is
mean,
all fine.
now I finally get to meet him. So, thanks for having me. Let me know when you're
Church. I was only doing some work on it. Nobody bring me there.
But a little bit of contact, emails.
My mother did make a sheet back in the 60s.
Okay,
Matching
Can I get some?
Not as much as Tom. Yeah, but I did some slave work. And I got on that side. You know. It's been a while since I've done that.
yeah. But I don't think.
You're not even at all.
I've tried to get them after several years. It was
They're in shooting. They want kind of
seafood. Hot pie. We just had all kinds of stuff that I didn't Very seafood.
You ever? Yeah. I voted against the story bar.
So. Yeah, I'll get it.
So you offer the
Nice job.
police, you know, you right.
Fortunately, this end,
All right, team, we're ready to get this party started. Great group of people here, probably the largest crowd we've had since we've come back from COVID. Got a good group on Zoom today as well. Excited about our speaker today. We don't do a lot of nonprofits, but we try to bring nonprofits that we have partnerships with or potential partnerships with. So glad to have Mary here, thank you for being here. Quick rundown of upcoming meetings. I'm excited about next week. I tried to get some information out of both gyms that I could put in the presentation today, and they stonewalled me and said, no. We're ready for a good meeting next week, so we'll save all the material for there. So robotics teams are back in action. They went to the first robotics competition last weekend, I believe it was, Jim. And before that, we traveled recently, so I'm really excited. And the robot's coming, right, Jim? Robot's coming. Okay, awesome. We're excited about it. And the kids, which the kids are more important, sorry, but the robots are coming too. All right, we got a children's choir. We'll have some fun on the 27th. We are rescheduling the Rotary picnic because your illustrious leader can't schedule well, and that is the weekend of the district conference. And we can't schedule something over there yet, right? So that's the feedback I got at the board meeting. So we're rescheduling that, and we're pretty sure it's going to be the 21st. We'll confirm that this week in an email, but it's the 21st. That way the water will be warmer, and we can put Cliff around on the inner tube behind the boat. Because if we try to do that in April, it'd be too cold to bring Cliff out on the boat. So Cliff, we're looking forward to that on the 21st. That's been rescheduled. We're going to go ahead and keep no meeting on May 4th. Since that's been in the calendar anyway, and May 7th, we really want to focus on our fundraiser and provide all the support we can behind that. So if you just feel like you've got to do something Rotary-wise and you don't have your meeting on the 4th, then check with Joanne on how you can help with the fundraiser setup. So we appreciate that. Derby Day, we're really excited, and maybe that has something to do with the hat. Mazda Toyota Manufacturing will be here on the 11th. They're obviously continuing to ramp up and do a great job and build our community, so we're excited to hear about their progress. They're already starting to produce one-of-a-kind cars out there, so pretty excited. With that, I'm going to have Melody come up and introduce some guests, and then we'll introduce our special guest in just a second.
All right, well, visiting Rotarians, of course, Robert is with us from the Madison Club. And you'll get more introduction of our guest speaker, Mary Elizabeth, here in a minute, but she is a visiting Rotarian also from the Huntsville Rotary Club. And we have a couple of folks who have guests today. Sam, would you introduce your guest? Sam Lowry?
Yes. Long time friend and
All right, and Alex McDowell has a guest.
yes, so my guest is Connie Crockett.
just like how I oversee scouting here at Madison County, she oversees scouting over in Athens, Decatur, and Coleman. And trying to give her a good taste of what Rotary is all about, so I brought her along.
Excellent, welcome to all our kids. And I think that's everything I was supposed to do. Except Brad, this guy got his hat, you know. Last week he told me he would wear any hat I brought. I told y'all that, so I did him good, didn't I?
Kept to my word, kept to my word. All right. With that, I'm going to ask a good friend and fellow previous Rotarian of this club that we miss dearly, Jackie Scheib, to come up and introduce her group. Come on up, Jackie.
Thank you, Chris. I'm so excited about being back. Thanks to Rotary, Huntsville Rotary Club for our partnership. So Thrive, it's not just you, but Global Ties Alabama also. And whenever we're hosting international visitors, we're so thankful that we can introduce them to you. Believe it or not, this is our second in-person delegation since March of 2020. All of the work that we were doing was virtual. We had a group in February from Hungary. And you'll notice this says Open World. It's a congressional program. When the Soviet Union broke up and our Congress said all of these new democracies are existing, they're going to need help to be strengthened. And so the Open World program started with mostly Eastern European countries, and we bring 5 visitors along with their facilitator who comes to experience the American way of doing things. And this week, we've had the honor of hosting our delegation from Kyrgyzstan, and they are cybersecurity professionals. For the government, for banks, a journalist is with the group. It's been outstanding. So when we said yes, we would host them, I got a little nervous. I said, will we really welcome cybersecurity professionals? And I can't tell you how welcoming our cybersecurity community has been. They've met with business owners, they've met with our mayor, they met with Mike Ball, they met with Senator Shelby's office. This morning, they were over at our cyber school touring, and I got to see photos of them interacting with the students, so you know that had to be a one-of-a-kind experience. So I'm just going to ask 2 of them if they would come up and briefly introduce the team, because you know I might not get the names accurate. So we'll ask Alkin if he would come up. He's in the financial intelligence area, and Perazak is an official to the president of Kyrgyzstan. When our intern who's with us, Sydney Wood, is an intern from Oakwood University, and their translator is a member of our community, Olga Osagis, who's a member of our board. When Sydney was in her meeting with them yesterday, she's seen their names and titles. But when she heard them introduced, she came back to the office saying, I can't believe I'm meeting with these officials from another country. So we're so excited, and I'll allow them to introduce themselves.
Good day for everybody. So as you know, we come from Kyrgyzstan. Our native language is Kyrgyz. It was easy to learn by heart. I know about some little words in English. I'm very nervous because you are so many beautiful people here. So we are from government representative, and we are here. This is our facilitator, Erkin. He is the U.S. Embassy government, and our delegation. Each of us made something great. For example, this person is head of the digital department for president office. I am the deputy chairman of the financial intelligence service. This guy is called Akıl. She is the digital policy. International Ministry of Affairs. Azamat, she is the IT cybersecurity expert in National Bank. And also Elizaveta, she is the independent journals researcher. She is always writing something for government. But she's not writing the good things, she's writing the real things that the government does like. And so we are just IT specialists. I don't want to bore you. We came and we know that, we acknowledge that the Huntsville is the most silent and polite city in the world, I suppose. Thank you for
Yeah, as my colleague said, we are very glad to be here and we appreciate you for having us and we are excited to have a good time in here together with you. Thank you.
Well, welcome and thank you for being here. And Jackie, it's nice to kind of get back to our partnership a little bit, so we appreciate you. I did want to say a word for Olga. Unfortunately, we heard your father passed recently, and Sergey has helped us on many ramp builds and been a good man to us, so thank you for that. All right. All right, we had a great weekend, didn't we? Another life change, big old ramp. There's the completed ramp and all the people that showed up in the last minute to jump in the picture. No, they worked hard. But I always want to recognize the folks throughout the week, right? So our Wednesday folks here doing the pre-build, thank you for that. Friday on the left-hand side there, delivering everything for the ramp build, and everybody showing up there on Saturday, and that's what the start would have looked like before the ramp was completed. All the great folks, and there's a lot of folks that are there every single time we do a ramp build. We really appreciate you. Some new folks showing up, and that was a big boy, wasn't it, Pete? Do you guys have anything you wanted to say about that? The next one is May 14th. Okay, so we're looking forward to that and get some more information out on that. But again, we appreciate Pete and Cliff for all of your coordination and hard work on that. So thank you very much. All right, let's have our fundraiser chair. Come on. Wear the hat for you.
I appreciate that. I truly appreciate that. Thank you. So I didn't want to scare anybody last week, but apparently I did about the seats, okay? Everybody will have a seat. There are plenty of seats at the facility. It's just that you won't have a designated seat at a designated table. That was what I was trying to get across. But we still have plenty of space. We welcome everybody. Joe, there's plenty of space out there on the rooftop, isn't there? That's right. So please plan on coming. We look forward to it. It's going to be a great event. I want to thank our presenting sponsor, Five Stones Research, for coming through for us. And, are you listening? Our Triple Crown sponsors, Claus Jewelers, Redstone Federal Credit Union, who are always here supporting us, my firm, and Chris and Melody for Winner Circle sponsorships, and our Medjugorje just keep growing, so please join the train. We'll look forward to seeing you, and I also wanted to remind everyone there will be a hat and bow tie contest. So if you're so inclined, you can enter both of those. Chris has a leg up.
Thank you, Joanne. Appreciate your hard work putting this together again for us. All right, just a reminder on Ukraine assistance. I sent out an email today. It includes the original presentation we had from Karina 2 weeks ago about the specifics on the refugee crisis, and then a presentation and plan for assistance that she presented to our board. You'll see the email. Right now, we as an organization don't have the capacity to lead that effort. It's quite complicated, but it's a very good plan. And so we're going to do our best to promote that plan and help connect Karina with other folks in the community that might be able to lead that initiative. Also in that email, we sent out the details about how Rotary Foundation is specifically working to assist in this as well. And there's a link to the Rotary International website to give money or help support there. Okay, so look for that email. This will be up on the website shortly. We're working on that now, as well as additional details on the Derby Day. So we'll have the actual address and specific information on the website this week, so you can point people to that. All right, any other club announcements I'm missing? We made a call for help with the foundation treasurer, and just miraculously it was handled in the meeting last week, right, Greg? So that was awesome. So now we're making a call for help for our membership committee. This is one of our most important committees. It works hard to build strategies such as our Flex membership and help us go find new members and market ourselves for new members. Helps integrate new members into the club so we can get them connected and be more productive. We try to connect with non-active members. So those folks that we haven't heard from in a while, we might be worried about them. We just want to try to re-engage them. We work on that. And we spend time recognizing club and life milestones of our membership. And in general, promote the club. So if you'd like to be part of that team, we've got a great leader, Mary Edgecombe, but she needs some help. So if you'd like to help, please let us know. All right, any other announcements? All right, with that, we're gonna have Cliff come up and introduce our guest speaker, and away we go.
We'll tell some stories now. All right. Gang Rotarians, it gives me a great pleasure today to introduce a friend of mine who I didn't know until in 2001, and leadership class 15 here in Huntsville. And Mary Elizabeth showed up, and of course I was there, and I was sitting in the corner being very quiet. She was trying to lead the group down a path of no return, but we survived, and as we had the battle cry of "Hua," remember that? Yeah, that's what it is. You can see a bus rocket when you got everybody saying "Hua" as we go by the arsenal and things. But anyway, getting on with, we sent the email out that gave Mary Elizabeth's bio, so I'm not going to go over that, but I will tell you that, she has been in the healthcare business since 1992. She has a very, very personal and very strong will to help the people they need help, that possibly do not have a voice, in not only the community, but in agencies across the board. And she has taken that on. She has continued to do that, and I'm sure that she's going to be talking to you a little bit more about that. So at this time, Rotarians, please give me a warm welcome to Mary Elizabeth Barnes.
Okay. I have very much been known to speak very fast, so I'm going to just jump right in. Thrive, Alabama. For those of you who don't know who we are, we started out a long, long time ago, 1988, as the AIDS Action Coalition. We started out taking care of people living with HIV and AIDS. We are an extremely diverse staff. We have diverse people that we assist. And this is our leadership team, our C-suite over here. Our mission, though, is to take care and to create a healthy community by providing compassionate, accessible, affordable, comprehensive health care. So, as our story, like I said, we started out in 1988, and unbeknownst to us, we had this young gentleman, Joe Davis, not the mayor, Joe Davis. Joe Davis was a client of ours, and unbeknownst to us, he left an insurance policy to us. And that is actually what kind of started our clinic. By 2000, we were having 2 half-day-a-week clinics, and those were being assisted by UAB, some doctors over at UAB. And then in 2004, we opened a satellite site out in Florence. So we cover Mississippi to Georgia and Tennessee down to Birmingham through Coleman for our HIV care and our STD care. Our FQ is here in Huntsville. So we had some very strategic growth over the years. As Cliff said, I've been in at Thrive since 1992, first as a board member, and then as the first education person, and then the director and now CEO. We saw back in 2015, I had all these federal friends of mine that said, you need to diversify. and it's true, the HIV care that we provide, we have gone from 198 clients when I started, we have over 1,000 now, and we've gotten no new federal money over the years. So I had to kind of look outside the box to figure out how I could continue to take care of these individuals. And the way I did that was, first of all, to provide us the great care we were providing for HIV positive people for HIV negative people. What that did, it did a wonderful thing. It lessened the stigma of HIV and AIDS by, we first changed our name to Thrive Alabama. That's what we're trying to do, is to help people thrive in their health care. And so people do not know when they're in the waiting room who they're sitting next to. It could be an emergency room doctor, it could be a lawyer, it could be a homeless person. But you don't know what you're there for until you get back to the doctor's offices. We also added STD to our Huntsville campus. We opened a satellite site in Albertville, so now we've got Florence, Albertville, and here in Huntsville. We launched a 33-foot mobile unit that has an exam room in it. We modeled it after the Huntsville Hospital green buses. It has a wheelchair lift on the back of it. And we wanted to begin the process of becoming a federally qualified health center lookalike. Now, what you do to become a lookalike is that you have to prove that you can do everything that a lookalike does, but you get no money, which is really interesting. But why did we want to become an FQ? The reason we did was that we needed access to the increased federal funds. We wanted to get the enhanced Medicaid, Medicare rate. Those of you who have elderly family members, it's really difficult to find a doctor that's going to take Medicaid or Medicare. Because their reimbursement rate is so low that they can't sustain themselves. As a federally qualified health center, we get an enhanced rate, and that the federal government recognizes the fact that we need to be the safety net for people. So we also get federal malpractice coverage because essentially these individuals are government employees in a very roundabout way, but in other words, the federal government will help with the malpractice and coverage. We also get access to 340B drugs, and this is I could talk all day about 340B drugs, but essentially we purchase drugs at 40% of their cost. So let's say that a drug costs $1,000 a month, and we buy it for $400. Then we use contract pharmacies, and we have some expenses there, but we basically get $450 off of that $1,000. And that has made us, it's made us very sustainable. It's a program, a federal program, 340B, but it uses no taxpayer money. All of the money comes from the pharmaceutical companies and the insurance companies. Isn't that a great thing? So it also, we wanted to have integrated rather than parallel systems of care. In other words, we wanted to work with people in the community, and then we needed to make sure that we had community-based prevention and care networks. So we did a community health needs assessment, and the reason that we did this, you have to tell the federal government that there's actually a need. So we did that, and we found that in Huntsville, lack of transportation, low-cost dental services. We do have the community-free clinic, dental clinic, but they have a waiting list constantly. We've never gotten any of our clients in there. Provider shortages, you hear about that all over the place. Behavioral health and substance abuse services are very, very difficult to come by, especially if you have no insurance. And then primary care and disease, chronic care management. So what we also found was that 92 to 94,000 people in Madison County do not have adequate health care. Think about that. Madison County, the richest county in Alabama, and we have that many people who do not have adequate places to go. So where do you think they go? Where do they go, Cliff? The emergency room. They go to the emergency room. That is what we call uncompensated care. Huntsville Hospital and Crestwood both have a lot of people in their emergency room that don't need to be there. It's not an emergency. A sore throat, a headache, yes, heart attack is an emergency, but other things are not. And so one of our missions is to reduce the amount of people that go to the emergency room for their primary care. So if you've been to the emergency room in your lifetime, your physician or your nurse practitioner will say at the end of the visit, now follow up with your primary care physician. Knowing full well that these people do not have a primary care physician or they wouldn't be there. So we looked at our strengths and we knew that we provided compassionate care. We wanted to treat the whole person. We wanted to establish and nurture our community partnerships, and we wanted to help with meeting the needs of the larger Huntsville and Madison County medical community. So after 1 year, thank God, of being a federally qualified health center lookalike, we became one of only 25 clinics in the nation that got our full designation. It is extremely, extremely hard to get. I think I've lost my mind most days that I've done it, but it's very hard to do. There were other organizations that added on to their scope, but we were one of 25 that actually got a new designation. And since that time, they have not given any new designations. This was in 2019, and the federal government has not had the money to add any new clinics. So this is just a small number of the people that we partner with in the community. I never want to provide services that someone else can do. And that is how we work as a community and be a good steward of our money and the resources that we have. So we work with anybody and everybody that wants to help out the same community that we help. During COVID, Huntsville Hospital came to us and said, we want to partner with you in doing the drive-through COVID-19 response. And this is the front of our big mobile van, and these are two of our fabulous social workers who were helping for months and months and months when we were over in Joe Davis Stadium. Then what we did was that we went to the churches in North Huntsville and the community organizations in North Huntsville. There are people in Huntsville that won't come below Drake to get services or to shop, to do anything. And so we went to the churches, worked with the pastors, pulled up our mobile vehicle outside their church in the parking lot, and did COVID testing. And it was really such a worthwhile experience. We now give COVID vaccines. We give them free of charge. The government is no longer giving us those tests free of charge, but we are continuing not to charge anyone for COVID vaccines. We also, before I go to that slide, I want to say that back in September, Crestwood had a pediatrics practice that they could no longer be sustainable because it was 65% Medicaid children. And they said, we're just going to close it. And I said, I want it. I'll buy it. Seems funny to buy a practice, but we basically took over the practice. We kept the nurse practitioner, the pediatrician, and most of the staff that wanted to stay. We have stayed on the Crestwood campus right now because we don't have our new building. And we're seeing about 1,900 children now at that pediatric practice, and there's a possibility of us moving up to 3,000. That's how many we're going to Crestwood, and during COVID, a lot of people just stopped going to the doctor and those kinds of things. So we're now, actually Jay just came up with a great little postcard that we're gonna send out to all the pediatric patients to say, come on back, we're open. So we need healthcare, and currently 65% of our clients either have no insurance at all, are on Medicaid or Medicare. Now, there are some organizations that'll help that have a community-free clinic, but they don't take care of people who have absolutely no insurance. We turn no one away. We cannot turn anyone away being a federally qualified health center. So that means that anyone who walks through our door needs to get our care. So this is where we currently are. If you can kind of visualize the north part, or the up here on the top, no, up on the bottom, yeah, down on the bottom, is the back, the parking lot of First Baptist Church, the back parking lot. We are in 6 buildings in that old complex. It used to be Huntsville Pediatrics, used to be our big building down here. All of my children went there, and probably your children went there as well. The problem is, first of all, we are at capacity. We cannot see any more patients with the amount of space that we have. We have different things in all those different buildings. But as we all know, Huntsville is growing. We've been here for 25 years, and the owners of our buildings sold the property to a speculator from Chicago. And they are bulldozing this space and going to put up a high-rise and multi-use on the bottom floor. So we know that happens in our community everywhere we look. So even though we are attempting to start breaking ground on a building, which I'm going to show you in a moment, right now, as of June 1st, we're out of a place to live. So we're having to go. We got one building is behind Rooms to Go. We call it our Rooms to Go building. We've got one on the Parkway. We're going to be where the VA used to be at UAB. And we're going to be at Pediatrics at Crestwood. And we're going to be at our administrative offices are going to stay on Governor's Drive, right behind where the Checkers used to be. We're on the 2nd floor. So we currently have 7,000 patients. When we move into our new building, we will grow immediately to 14,000 unduplicated patients, and we hope to have evening and Saturday clinics as well. So we'll be able to see twice the amount of people. So this is what our building is going to look like, and it's going to be built on the corner. Those of you who have been in Huntsville for a while, it's going to be on the corner of Oakwood and Washington Street, which used to be, I've had so many people tell me, oh my gosh, that's where the stockyards used to be in Huntsville. And I said, yep, and it's really nice ground, and it's nice, fertile, wonderful ground. Go by it and just imagine this building on that piece of property. You know, it's not only that this is a community project, it's needed, it's desperately needed, but think about it, it's going to be in an area of Huntsville that is kind of a desert for healthcare, for a pharmacy, for laboratory services, for all kinds of things. We're wanting to help revitalize North Huntsville as well. Oops, come on. Okay, so everything's going to be under one roof. You can kind of look, we already have substance abuse services and mental health services, but it's going to be much bigger. We have a very small food pantry just for what somebody needs that day. Then we send people to Manna House or to the other churches that have food banks. We're going to have patient eligibility. I was telling at my table that we have a wonderful person who gets people onto the ACA, make sure that they don't get insurance programs that are not really that good, and also helps people sign up for Medicaid and for Medicare. There are some people, my ex-husband, I said, "Are you on Medicare? You turned 65, and he said, "No, I didn't know I was supposed to do it." Anyway, that's another whole story. Primary health care on the second level, along with pediatrics and social work. And then on the third level, we're going to have dental care, we're going to have vision care, we're going to have a PrEP clinic, which is a pill that people can take once a day, and they won't essentially get HIV from sexual contact. An STI clinic, and then nutritional services and health education. Also, Jay and my offices will be up on the third floor as well. I'm going to get, after 30 years, I'm going to get a window. So this is how you can look and see our current makeup of who we have in our working providers, and then what we're going to grow to. So it's going to be, we're going to go from 13 adult exam rooms to 52. So it's going to be a very large facility. This is like my computer, it just doesn't want to do it. Okay, so the building is $33 million. And we shouldn't probably have put that slide in there, Jay. Missed it. Okay. We are hoping to offer that holistic healthcare collaborate with the existing people in town, like Huntsville Hospital, Crestwood, and Community Free Clinic and Heals Clinic. Provide compassionate care to everyone. And that's really what we're made of, is compassionate care. And then the revitalizing of North Huntsville. We're really excited because the city has agreed to go right beside our property, like on the edge of our property with the greenway that's going to happen in North Huntsville. That's going to be amazing for us because we're also going to be able to use that for mental health and substance abuse. So we've had some people, this is how we're funding the project. We have some naming opportunities, but I want to show you a video real quick. Whoops. Mike? This is why it's so great to have somebody that knows don't hesitate to contact me or contact Joanne. Joanne's a good friend of the organization. So if there are any questions, I can answer them, but I know we're getting close to leaving time. Yes.
I apologize for asking. I just would like to know, we have a couple of refugee families from Ukraine already arriving in Huntsville area. Would that be possible?
Absolutely. We take care of people regardless of their national, we take care of undocumented people all the time. About 7% of our clients are Hispanic or Hispanic origin, and about 5% of them don't speak enough English. And we have translators, and we also use a language line if it's for other countries that we don't speak the language, because you can't provide health care with someone who they don't understand what you're saying. Yes, we would love to see them. Children, infants, all the way to the elderly. Any other questions? Yes?
The expansion of Medicaid and how that would help.
It would help us tremendously. And it would help the state of Alabama in many, many ways. It would be revenue generating for Alabama, not just in the federal money that hopefully we can still get some of those match dollars, but not only that, it will bring money back into the community and jobs. It'll increase the health care for individuals. Think about the person who works 3 jobs. Maybe they work at McDonald's, Wendy's, and somewhere else. And maybe they don't work enough to get insurance from any one of those entities. And so those are the people that I hurt so bad for, because we don't have Medicaid in our state to help those individuals who just don't make enough money to have insurance. Other questions? Yes?
How much of your building is in funded?
We're working right now on about 1.8. The community support has been phenomenal. I was told by people, you're not going to raise any money doing this, but I have a lot of irons in the fire that I'm just kind of waiting. Some big monies, 2 million, 5 million, 6 million, that we're just kind of waiting on. And as we get those, we will let people know. Yes?
Does the property there on Oakwood have room for you to expand?
It does. It does. About the last back third of the property is not part of this project, and we could either hang on to it, sell it, put something else on it.
Yeah, I hope you don't need it, but I fear you will.
Well, I hope not. I hope we don't, make the mistake that a lot of people do with moving into a space that is already too small for the growth that you need to do. We've done a lot of work with Chapman Sisson on making sure we don't have a lot of shell space. I wish I had money to put a 4th floor on just as a shell, but that would have been cost prohibitive with the money that we thought we could raise. Yes. Well, if there's no other questions, I thank you so much, Cliff and Chris and Joanne and Melanie, all of you all for being so kind and
Mary Elizabeth,
taking this information and hopefully being able to do something with it. If you have people that need health care, just let us know in any other ways, and take our information and give us a call. So thank you.
Very much for that. It's always nice to hear about people really making a difference in our community, and for the people that really need it the most. And it's nice that we can support that and be part of it. So thank you. Really appreciate it. And you've been doing this for a long time. So thank you for all of your hard work. Any other announcements, questions? We have some updates on our dates for the picnic and everything coming out this week, so keep an eye out for that. All right. If there's nothing else, let's stand and end with our 4-way test. As Rotarians, all the things we think, say, or do First? Second? Third? And fourth? Thank you for being here. Thanks for being Rotarians. And thanks for being here for our special guest.